The dentists need to understand that we need you assistants. You assistants are not perfect. We got to get over that. We all need to look at each other as vulnerable human beings. Every single one of us, the most high and mighty and powerful doc, is vulnerable. Make sure that you understand that every person in that office is a human being who is carrying something. I want this profession to get better. I want to take it back. And I want to make it a source of fulfillment for each and every one of us so we can do good for our patients.
Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. This is in conjunction with Dr. Bicuspid because we're talking about things that are important to the assistant today, but as well as the dentist. And that's why I am thrilled today to have on my good friend, Dr. Alan Stern. Dr. Stern, how are you, man?
Kevin, I'm doing great down in Florida, doing real good for, I'll be 6 decades in a couple of weeks, and I'm stronger than ever. So I'm doing great. I'm on fire. I'm personally and professionally, we're doing awesome, Kevin. Thank you. Thank you for having me.
Oh my gosh, I'm so glad to have you. And absolutely, Dr. Stern is somebody that I've come across the speaking circuit, the consulting circuit, just the thought leader circuit. And I'm so glad that you're part of this today because when somebody reaches out to me and says, we need to talk to dental assistants, I'm all ears. And I'm always excited about that. So I'm just going to start off with the 30,000-foot view question, man. What's on your heart right now? Because you said you wanted to speak to dental assistants, and I'm going to turn the floor over to you, and then we're going to chat about it.
Yeah, we had other things on our mind before this happened, but the dental assistant community on Facebook has been kind enough to welcome me, and my motivation is to learn. My motivation is to understand what's on the minds of the people we need so badly, and we all need each other. Yeah. And to see if I can't address it from a dentist's point of view, from a former practice owner's, a former associate's point of view. And I've also worked for large institutions, and I've met all kinds of assistants in all kinds of roles with all kinds of views of what their jobs should be. And I think there are answers if we're willing to embrace the discomfort of talking about them. So we have I think, the sins of the past have been that, look, dentists have talked about the girls. Yep. For me, I'm a child of the 60s. So it was always the girl in Dr. Bob's office. And that carried forth until very, very recently, until we dentists realized, we need them.
Yeah. Holy
smoke, I can't find an assistant. How am I going to get my work done?
Yep.
And it's taken this long for a large number, not all of us. There are some great practitioners out there who treat their team members like team members, and they're vested in each other's well-being. That's where I want things to go, but we need to understand, the dentists need to understand that we need you assistants. We need you. You assistants need to understand that you need us, and we all need the patients.
Yep.
We need to understand. We dentists need to understand. You assistants are not perfect. We got to get over that. And I'm humbly and lovingly asking you to look at us dentists and say, hey, doc, you're not perfect. I'm over it. You get over it too. Let's make each other better. Because when you see, I can't tell you how many times my assistant has looked from the other side of the chair and said, hey, Dr. Stern or Alan, you think you might have a little rough corner on that incisal edge? And at first, the dentist in me said, who the heck are you to look at the great me's working on? I'm looking, holy smoke, she saw that? And I would say, hey, thanks, man, that's good, keep doing that. So we need to get at that mutual growth, see each other's blind spots, points in our careers, and say, let's help each other. Let's stop the tug of war and let's start pushing toward making each other better for the sake of the patient.
Okay, so here's the big question, because if you're in the dental assistant community, you hear this just as much as I do, is that I don't have that dentist that was like you and said, oh gosh, I'm glad she told me that. You have those that keep puffed up and are like, how dare she question me? how do we get past the dentists that don't want to see imperfections in each other? That's the big question I've got for you, my friend.
It's all right. I will admit right now, in front of all of you, it's easier said than done, but it's doable. Difficult conversations are a part of life. And we need to understand, we need to approach, if you're the dental assistant, I would dare say, again, with love in my heart and good intent in my brain, say, hey, doc, would you be open to me pointing out a few things to you? Because there's some things that I'm seeing that may or may not be perfect. And I understand sometimes I, the assistant, may be overseeing things. But if we can reframe our discussions in front of the patient where it's mutually respectful, and you could say, hey, thanks, Alice. That's awesome. I'm so glad you saw that. Hey, Miss Patient, I've got the greatest assistant in the world over there. Alice is my second set of eyes. And, Alice may not have the right instrument at the right time for that dentist. And that dentist may get a little bit agitated because we're under a ton of pressure. And we'll talk about that in a moment.
Yeah.
We'll talk about where this all comes from. But the dentist, instead of saying, damn it, Alice, where the hell was that cord packer when I needed it? Instead, hey, Alice, I noticed the cord packer was missing on that last crown and bridge setup. How can I help you? What's getting in the way? And how can I help you, or how can the rest of the team help you to make sure that we got everything right so that Miss Patient doesn't see a disconnect? How can we do that and make this practice run better, less stressful for all of us? That's how to do that.
And I think you hit on a key point. It's not about I'm right, you're wrong, vice versa, whatever it is. It's a better experience for the patient. And it's a better thing for him or her sitting in the chair whenever they walk out to go, not only was that a smooth visit, but those people worked just like the dance that we always talk about that needs to happen in the practice.
Yeah. And, sometimes even one silly little thing, please, can you please hand me this?
Yeah.
Can you please go get the cord packer, damn it? No, we don't want to do that. But we sometimes just a little courtesy, because we're working in such close physical and mental proximity. And there's an emotional component of it, whether you like it or not.
Sure.
There is an emotional component of being so close to that person that you need.
Mm-hmm. So, you teased a minute ago the stress that's there. And I think it's important for us in this podcast and in real life to acknowledge that there's a lot of stress in every part of the practice. The dentist has his or her own, so does the assistant. So how do we know the other stress and take that into account whenever those questions are answered maybe not the way that we want them to be?
Well, the first thing we do when we walk into the office is invoke Alanism number 1 of my currently 96 Alanisms, and that is show me a person without stress and I'll show you a cadaver. We're all carrying it. Alice, the assistant coming in, is carrying something. Danny, the doctor, is carrying something. But assistants, let's understand this, please, that your doc is under tremendous pressure that you may not be privy to. Debt, bills coming in, insurance hassles. The system is really putting undue pressure on your dentist. Whether your dentist is an owner, an associate, a partner, don't care what, an employee of a big organization, there are pressures that are being put on this dentist that you don't want to know about. You really don't. But here's the thing that some of us don't realize, that we need you to help mitigate some of that pressure. Mm-hmm. Alanism number 32, anger is fear in disguise. When you see that dentist's hand shaking and the smoke starting to come out of his or her ears, understand that it's fear. Something is going on there that's causing this practitioner to get really agitated. And chances are it's not you.
Yeah.
Chances are it's some other pressure that they don't want to burden you with. And they shouldn't.
And I think you mentioned a minute ago that we need to kind of look at each other in a little bit different light. And I think that includes looking at each other as human beings as well. Not a dentist, not a dental assistant, humans and humans who have stress as well. And yet you're in this tight little area where you have to work together. And
Yeah.
I love it.
Yeah. The one thing I want you all to think of yourselves, are you a human being or are you a human doing? You're a human doing sacred work, changing people's lives. Even the stupidest class 1 composite, it's not so stupid.
Right.
Because whether the patient realizes it or not, that composite is preventing a ton and a half of problems, and you, assistant, Ms. or Mr. Assistant, are part of that solution. Your contribution is critical to sacred work in the world. Understand that.
Yeah, absolutely. And I think understanding not only each other, but again, the world around us right now with all the staffing shortages going on, all the things that are impacting the dental practice, and making sure that, and I'm going to talk to the dentist for just a minute. Dentists, if you want to keep your assistants, it is about treating them the right way. But assistants, you're not immune from this either. I think we have to treat each other as you would want to be treated, for lack of a better, as silly as that may sound.
Yeah, we all need to look at each other as vulnerable human beings. Every single one of us, the most high and mighty and powerful doc, is vulnerable.
Absolutely.
We are a profession that is under siege right now, where our intention is good, but there are things being thrown at us that are completely unjust and unfair. And what do we do about it? I didn't walk away. And by the way, I was not a perfect employer. I was good, but I made my mistakes too. So I'm just going to tell you right off the bat, even St. Allen here is not such a saint. I did well. My team members loved me, but not all of them and not all the time. Some of it was wrong hiring, some of it was there on them, and some of it was on me. So this is an imperfect process. And may I throw in, Kevin, one other little thing for you all, and that is sometimes a good assistant and a good doc just don't work.
Yep.
Sometimes you're just not a good fit. And recognize it, and you could have that talk with the doc. And I will suggest to you all also that when you interview, first of all, be yourself. Don't present as anything other than what you are. Ask the doc a lot of questions about the practice. Interview your doc just as much as your doc is interviewing you, and get to know each other.
Yes. Yeah. I'm such a big believer that interviews have turned into one-way streets, and the assistant never thinks to ask the questions, or maybe doesn't have the courage to ask the questions that he or she might need the answers to. Yeah. And I think that is just as much part of the interview process as, the dentist asking the assistant about background or whatever else it may be.
It's terribly important. And ask open-ended questions. Tell me about yourself. Tell me what you love about dentistry. Ask the same questions of the doc as they ask of you. And talk to the team also when you're interviewing. Make sure you've got a good fit. So docs and assistants.
Absolutely. Yeah, because the worst thing that can happen is during this era of a staffing shortage, you hire the heartbeat, not the right person, or you find a job because you need a job, not because it's the place where you should be. So Alan, I got to ask you, as we wrap up here a little bit, what's the biggest thing that you want to leave for both dentists and assistants here? And then I'm going to make sure that people know how to get a hold of you to ask more questions.
Make sure that you're doing good while you're doing well. Make sure that you understand that every person in that office is a human being who is carrying something. Make sure that you know that when somebody gets a little bit out of sorts, even the patients, it's fear in disguise or pain in disguise. And if you could get to that from a humble and loving point of view, and yes, love does belong in the workplace. Lead with love of humanity. You will never go wrong, and your life is going to be better.
Hey friends, I'm heading to Nashville this year to speak at Accelerate the Dental Revenue Workshop. This isn't just another event. It's packed with real strategies, real solutions, and the kind of insight that actually moves your practice forward. If you're ready to grow, lead, and finally make your systems work for you, grab your ticket. Use my code KevinH to save $150, and I'll see you in Music City.
Wise words, my friend. So tell people how they learn more about you, where they get in touch with you, because I have a feeling you've opened up some questions here with
Yeah, I would invite anybody to join my Facebook community, which is called Better, Richer, Stronger. It is open to all members of dental teams who care. The other thing you can do, if you've got a question, email me, alan@betterricherstronger.com. ALAN@betterricherstronger.com. I will answer your questions. I might even invite you to spend some time online with me on Zoom. I want this profession to get better. I want to take it back. And I want to make it a source of fulfillment for each and every one of us so we can do good for our patients.
Well, we're going to have Alan's contact info in the show notes. Very easy for you to find. If you're watching this on drbicuspid.com, hey, there's a link right here in the article where this video is embedded. So very easy way to get a hold of Alan. And as always, my friend, I appreciate your insight and your thought. And I'm all for making this industry better, just like you are.
Thank you so much for having me. Thanks for responding to my outreach. Yeah. And I'll see you on the road, my friend.
Absolutely. I'm looking forward to that. Next time our paths cross, that'll be a good thing. And thanks to all of you who listened to this episode of the Dental Assistant Nation podcast. In conjunction with Dr. Bicuspid, we always love to not only reach out to those assistants who always listen to us on DA Nation, but let's bring in those docs to hear what we're talking about as well. Until next time, it's Kevin Henry, Editor-in-Chief for Dr. Bicuspid and founder of Dental Assistant Nation, signing off, and as always, wishing you nothing but success ahead.